It's an emergency drill that Dixie Regional Medical Center has been preparing for, but hoped would never happen. 4 years ago, hospital emergency preparedness teams practiced what to do in a real pandemic. Now it looks like it might be here. Over the weekend, the hospital set up a triage tent outside the emergency room, where potential victims of the coronavirus will be evaluated and handled. Because there are only a limited number of beds inside this hospital, most of those people will be tested and prioritized on site. Most who question their illness should self-triage before even stepping foot inside the hospital's emergency room.
If you think you're having symptoms, do call ahead. Reach out to your doctor. Use the Connect Care app. They've been trained and they're going through lots of individuals to help them identify, do you need to go in for testing or not? And those individuals that are simply being screened for COVID and don't need to go in, that's occurring at no charge.
The 911 dispatch center is also expected to be inundated with calls. Those calls will be funneled through to the appropriate care. Most of the time, people will be directed to stay home unless if they are severely ill. Then they would be transported by ambulance or transport themselves. At a time when the world seems a little upside down, Carol says people need to take a look at themselves so they don't infect others.
Take a step back from ourselves and look at what is the impact to the community. Not just what's the impact to me as an individual, but would I potentially be an individual that would infect other people?
He says it only takes one person to infect or expose others. People who are immunocompromised and over 60 are said to be at higher risk, as are those who have traveled out of the country.
Certainly patients that have traveled to high-risk areas that's more concerning. So individuals that have been to China, been to South Korea, been to Italy, there's going to be a higher risk. Individuals that haven't traveled to any of those areas, the risk is lower.
Dixie Regional Medical Center has already put visitor restrictions in place.
We've limited visitors under the age of 18, unless they're sick, unless they're patients themselves. We've asked people that are sick not to come to the hospital. We have individuals stationed at the front desk so that everybody that comes into the hospital is having the opportunity, or is not just the opportunity, but is washing their hands with a hand sanitizer.
Dr. Carroll said that although testing has been limited, there hasn't been anyone turned away that he's aware of. So far, there are more tests available here than have been used, but that criteria for testing may also change. He said they are willing to do what they have to do to protect and help the community.
I think we need to strike that balance between the sky is falling and being prepared. And we want to make sure that people are protecting themselves. Good hand washing, limiting touching of the face. If you're feeling ill, to not expose yourselves to other people.
While we don't know what kind of federal funds might come this way to cover testing or help during this time of need, that's not the focus right now.
So our focus isn't financial. Our focus is on what's the right thing to do for the community, what's the right thing to do for any patient that we have in our hospital.
For more information on symptoms and what to do, check out the CDC website or your local health department, as well as intermountainhealthcare.org. In St. George, Melissa Anderson, Community Education News.